tips and tools for mindful medication use in Atlantic Canada. Thank you so much, everyone, for joining us for what we consider to be such an important conversation. My name is Jenny Hervin, and I'm the Patient and Community Engagement Lead with the Canadian Medication Appropriateness and Deprescribing Network. I also want to let you know that I'm a proud Maritimer, and I live and am speaking to you today from Wolfville, Nova Scotia. I'm really happy to see some names I recognize and a lot of new folks joining us today as well. We have a lot we want to share, so as people are still joining, I'm going to get us started. First, to help us ensure we do have good audio quality throughout the presentation, I'm going to ask everyone to please keep your microphone muted just throughout the presentation. Because not everyone was able to attend live, we are recording this session, and this recording will be posted on the CADeN YouTube channel. We will be sharing that link with you in an email following this webinar. In that follow-up email, we will also be including a PDF copy of today's slides, as well as some of the great resources we'll be sharing today. We'd love to hear from you. If you have any questions throughout the presentation today, we invite you to share those questions in the chat. You can find the chat button in the Zoom control panel. I just have my mouse over it here.
Mute.
And my colleague Ines and I will be monitoring the chat, and we'll either be answering your questions on the spot or saving them for Emily to answer during the question period at the end of her presentation. I want to take a moment now to acknowledge that I am speaking to you from a place known in the Mi'kmaq language as Mataban, meaning mud cat fishing ground. And this place is in Mi'kma'ki, the traditional unceded territory of the Mi'kmaq people. Most of us here today live in the Atlantic provinces, and so I would also like to acknowledge the Wolastoqiyik, the Pescotamoqadiak, the Inuit and the Innu nations who, along with the Mi'kmaq, have lived and stewarded the land in Atlantic Canada for millennia. This land is governed by the treaties of peace and friendship, which were first signed in 1726 by the Mi'kmaq, the Wolastoqiyik, the Pescotamoqadiak, and the British Crown. These treaties did not surrender or transfer land to the British, but rather they recognized these nations' title to the land and set the rules for what was to be a long, ongoing relationship between nations. Finally, as we discuss medication safety and deprescribing today, it's important to recognize that Indigenous peoples in Canada experience inequities in numerous health outcomes, including polypharmacy and harm from medications. This event wouldn't have been possible without the support of our longtime partners, the Newfoundland and Labrador 50+ Federation, the Retired Teachers Organization of the Nova Scotia Teachers Union, and the Canadian Association of Retired Teachers. We are ever grateful for the continued support of these organizations and their important contribution to bringing you this presentation today. I would also like to highlight two of the individuals who have contributed their vision, time, and support to this initiative, as well as to numerous other public awareness initiatives around medication safety since 2018. Linda Oldford is the president of the NL 50+ Federation, and Bill Berryman is the past president of the Retired Teachers Organization of the Nova Scotia Teachers Union, as well as the current president of the Canadian Association of Retired Teachers. Both Bill and Linda are members of our network's Public Awareness Committee. The members of this committee advocate for safer medication use in their communities, regions, and with their policymakers. And they also guide our network in our public awareness activities, including this webinar, and we're really grateful for the work they do. Of note, we are looking for a new member from PEI. So if you're from PEI and interested in learning more about this position, please reach out. And now I'm going to hand it over to Bill and then to Linda.
I'll let Linda start.
Oh, okay.
Linda,
Oh.
you're on mute.
Good?
Good.
Yep.
Hello, everyone. Very happy to be here. I became a member of the Public Awareness Committee in December 2023 after attending a national meeting in Montreal. To rewind just for a minute, I first heard about over-medication and over-prescribing when Dr. Justin Turner, who at the time was involved in a 3-year project funded by the Newfoundland and Labrador government entitled Saver Meds in Al, he presented at the annual 50+ convention in Newfoundland, and to say I was shocked by what he had to say is an understatement. I honestly did not know the seriousness of the problem. I was totally captivated and made up my mind right there at that moment that I would help. My first words to Dr. Justin Turner after I boldly introduced myself were, "I bet the pharmaceutical companies love you." That was the beginning of my involvement with this important issue. Later, Dr. Turner invited me to co-present with him about the Safer Meds NL project at the national meeting in Montreal. Fast forward to today, I am very much looking forward to this session. Thank you to the organizers and to all of you for participating and learning more about this important matter. Thank you.
Well, good afternoon, everyone. My name is Bill Berryman, and I have been a member of the Public Awareness Committee since August 2023. My eyes were first opened to the issue about medications for older adults when I was invited to go to Montreal as chair of the Seniors Advisory Council of Nova Scotia to attend the 2018 National Stakeholder Summit on Medication Safety for Older Men and Women. The statistics are alarming. We knew older adults were taking a lot of medication. This is common knowledge. What is not common knowledge is that when older adults take a lot of medication, the risk of harm increases. We need to take action now. Older adults, their caregivers, and healthcare professionals want information and tools to help manage medication safety. Wise medication use needs to be part of a healthy aging strategies and services provided by communities, organizations, healthcare centers, and governments. Thank you for participating in this webinar. Together, we can reduce the use of potentially harmful medication use across Atlantic Canada by empowering older adults to partner with their healthcare providers. Stay informed and ask questions such as, do I need this medication? Thank you for being here today.
Thanks so much, Bill and Linda. Now it's time to introduce our speaker. Dr. Emily G. McDonald is an associate professor of medicine in general internal medicine at McGill University. She is also a scientist and director of the Canadian Medication Appropriateness and Deprescribing Network. Dr. McDonald created MedSafer, a computer application to help patients and their healthcare providers deprescribe. Her research studies the safe use of medications and is funded by the Canadian Institutes of Health Research. And I could say a lot more about Emily, but in the interest of time, I'm going to hand it over to you now, Emily.
Thank you, Jenny. Thank you, Bill, and thank you, Linda, and to everybody online today who's joining for this webinar. It's a privilege and an honor to speak to you today about medication safety. I will share my slides. And I'll just advance to where I'm going to start here. Oh, by the way, this is a picture of me in Belgium next to the Queen of Belgium. And I was giving a talk on, she invited me because she had a symposium on mental health for older adults, and she wanted me to come and talk about medications. And you can see she's a very tall, statuesque woman, and they had set up the podium for her. And so when I went to give my talk, no one could see my head. I'm not quite a card-carrying member of Atlantic Canada, but I like to think I'm pretty close. I have one sister who was born in Halifax, and I, between the ages of 3 and 5, used to kind of run around and play on the Dalhousie campus where my mom was a teacher. And I absolutely loved the Halifax Library, where on the weekends, we used to go back in the summer and I would read all the Nancy Drew books, and they also had some really fun shows that would go on there. So I want to thank Health Canada, who gave us funding for the network, which helps us to give webinars and presentations like the one we're giving today. So here's the plan. Today we're going to talk about why it is we become more sensitive to the effects of medication with age. I'm going to talk to you about some situations where maybe the harms of medications outweigh the benefits. And, this is a very sensitive topic, and it also is different for each person, and it can also change over time. We're going to talk a little bit about how you, members of the public, caregivers, healthcare professionals, how we can all work together to prevent some of this harm, because a lot of these side effects that I'm going to talk about today are preventable. It's really just a matter of being able to recognize them. And then we're going to highlight some key resources, for example, where you could get a medication review done for someone you care about or for yourself. And that's going to be focused on the Atlantic Canada region. Okay, so I think, we all have an intuitive sense about why we take medications. Medications are beneficial, and oftentimes they're totally indicated, right? They can cure diseases like infections. If we have conditions like diabetes, high blood pressure, in addition to diet and exercise, they can help to, control our sugar, to bring our blood pressure down, make us feel better, make us live longer. They can help relieve some of our symptoms that we have, like if we get pain or if we have fever. And we've seen that over time, medications are prolonging life expectancy, right? So people are living longer and they're living healthier. So, what's the issue here? That's what we're really going to get into today. So I want to do a little caveat, which is at the end of the talk, it's not meant for you to go and stop all of your medications. And, we're going to be giving some general advice today, but each person is different. And so, if you're interested in coming off a medication, it should really be a discussion with someone that you trust who prescribes the medication, because not all medications can be stopped right away. Some of them need to be tapered gradually. And sometimes if you stop a medication, a symptom or a condition that it's treating can come back. But we're really just going to talk about how do you have a conversation with your prescriber about your medications? How do you bring up if you're concerned that maybe a medication isn't working for you anymore, or that maybe it's the cause of something that you're feeling, but you're not so sure. So what is all the fuss about? The issue that we've seen over time is that while we have been incredibly good at developing new medications and finding medications to treat symptoms and conditions, the number of medications that people are taking has started to grow and grow and grow. Such that, if we talk about people who are taking 5 or more medications, so we call that polypharmacy in science, or, multiple medications, that almost all older adults over the age of 65 are taking 5 or more medications. That's like 3/4 of people over the age of 65 are taking 5 or more medications now. And this certainly wasn't the case if we look back decades ago. And part of that is, again, because we have new medications and they help us and they make us feel better and they make us live longer. But we're starting to see that we've maybe overshot a little bit, and that some of these medications could actually be causing harm. So one of the reasons you know that there could be overprescribing is because when you take a look across different areas in Canada, within Canada, around the world, the number of people taking 5 or more medications varies. So in some provinces, you have a higher amount of people taking more medications, and in some provinces, you have a lower amount of people taking more medications, with the key being people's outcomes are the same. And so potentially all those medications aren't needed. And so we look to see, well, what's the average? When we look in Canada, about 62% of older adults are taking 5 or more medications. So then we start to see, well, okay, well, PEI is around that. And then we go to Newfoundland and Labrador, and they're quite a bit above that. That's about 1 in 10 more seniors, or 10% more, who are taking multiple medications. So it kind of is a bit of a red flag for us that maybe in some areas, there are too many medications being prescribed. It's just a general thing that we observe. Now let's take a look at 10 or more medications. So that's kind of like mega polypharmacy, when you're really taking so many medications that some of my patients tell me when I finish taking my pills in the morning, I don't have an appetite for the rest of the day, or I feel very drowsy and I'm spending a lot of the day asleep. And then at the end of the day, I have trouble sleeping overnight. Maybe I don't really feel confident driving my car anymore. I've had a fall. So, when we see people who take 5 or 10 medications, we do see that there's an increase in these, pretty serious side effects that can really impact the life of somebody when they occur. Like a fall with a hip fracture is more common when you take more medications. We see that sometimes cognitive memory decline occurs more often among people who are taking more medications. And when we look again across some of the provinces in Atlantic Canada, we see, PEI, about 17% of older adults are taking 10 or more medications. And then in New Brunswick and Newfoundland and Labrador, it's really high. It's up around 30%. So 1 in 3 adults are taking 10 or more medications. So there's variability, which means that maybe we could do better in some places than others, or maybe we should take a closer look and see what's going on. When we look at all of Canada, the amount of people over the age of 65 taking 10 or more medications is about a quarter, so 25%. So there's variability, and it's also very common to take multiple medications. So older adults, like all adults, are a diverse group. Why is it that in some places more medications are prescribed than others? That can be because there are differences in prescribing habits of doctors and nurse practitioners. It's because there's ethnic and cultural diversity amongst Canadian seniors. And then as a whole, there's different norms and beliefs regarding medication use. There's different norms and beliefs when it comes to pain, to difficulty sleeping, to tolerating acid reflux. And then depending on the context, this can result in either increased or reduced medication use. And so we definitely see changes in differences between Canadians, even within a province, based on their background and based on their prescriber. So it's really important to take a moment and pause and say, why is it that aging makes us more sensitive to the effects of medications? Because a lot of times when we talk about reviewing medications and discussing the harms and the benefits, these are medications that some people have been taking for 10, 20, or 30 years. And over time, you may feel that this medication is fine for you and that you've never really had an identified problem. Maybe it's a medication you've been taking for a long time. So here's what happens in our bodies. We end up taking more medications because with time, we do accrue more medical conditions with age. But sometimes we don't always reassess the benefits and the risks, and these can definitely change over time. And so, for example, it might make sense to take a cholesterol pill in your 30s and 40s and 50s, but you might have accrued quite a lot of benefit from a cholesterol pill when you are in your 80s and 90s, and so you might not need to take it anymore. And here's what happens in the body. So first of all, our brain becomes more sensitive to drug effects. And this actually, this isn't just in older adults. So if we look at women versus men, for example, women can be more sensitive to certain drug effects. Medications stay in the body because the amount of muscle and fat changes in the body, and medications can build up in different types of tissue in the body. So if you have more or less muscle or more or less fat, medications may stick around in the body more, or they may leave the body at a different rate. So they can affect you for longer, for example. And then our liver and kidneys don't process medications the same way or as efficiently as when we're younger. The same way our liver and kidney don't process medications, perhaps if we're dehydrated. So there's different scenarios in life where when you take a medication, the kidney may not be at its optimal state and it might not be processing the medication as much. So for example, you might have taken a sleeping pill for many years, but if you get a pneumonia and you get a bit dehydrated, that medication might build up and then it might make you fall down, even though you've taken it for 20 or 30 years and it's been fine until then. So who's most at risk of experiencing harm from medication? Well, anybody really at any age, if they take a medication that's not right for them, can experience harm. People over the age of 65 are particularly at risk of experiencing harm from medications, and especially when they take multiple medications, because the medications can start to interact and it can be complex physiology. So if you have multiple medical conditions and you take more medications, again, it becomes more and more complex. And we haven't always studied how this medication works in someone over the age of 65. Very rarely do we study how medications are acting in someone over the age of 75 or 85, because older adults aren't always recruited in the original trials where we studied these medications. And we often, when we're doing a study of a new medication, we might exclude people with multiple medical conditions. So a lot of times the data that we have on how medication works was studied in a younger person without a lot of medical conditions. So we don't always see the harms when we do a study. Women, more at risk of experiencing harm from medication. Again, there's different muscle and fat distribution in women than men. Sometimes women are, again, less represented in clinical trials, so the data we have isn't as representative for how to dose a drug in women. And the drug can be affected by different hormones in the body, so like estrogen versus testosterone. Women also have a longer life expectancy. They do tend to be labeled with more chronic medical conditions. So sometimes symptoms are labeled as a diagnosis when it's not always necessarily a medical condition, or they will come to their doctor and identify symptoms in themselves more than men. And so they'll get their medical condition more often diagnosed. And if you have more medical conditions and diagnoses, you end up taking more medications. And then again, that female biology and physiology increases the risks of harmful effects of medications. So there was a notice from the coroner that was sent out in Quebec because women in Quebec are prescribed the same dose of a sleeping pill called Zopiclone as men. There's no difference in that dose. But what they found was that the next day, that dose of the medication was still present in the system of women, which meant that it wasn't actually safe for them to drive. And there had been a fatal car crash in Quebec that was related to a woman being prescribed a dose of this sleeping pill that in the studies shouldn't really have been around the next morning. But those studies, again, didn't always include women, and the dose wasn't necessarily right for this person. And so there was a warning to physicians saying, you need to be careful about how you dose this medication in women. Okay, so I'm going to get into a concept here called medication overload. It's very related to what I've been talking about so far. And we're going to talk a bit again about why it matters. So medication overload is a term that we use that is meant to be more accessible to the public. And you can see in this photo, and you probably get a feeling when you hear the term medication overload that it's not really a good thing. Basically just means that you're taking medications where on the whole, the harms are outweighing the benefits. So you're having at least one medication that could be reassessed that's potentially not appropriate for you. We use this term to signal that it might be time for somebody to have a medication review. And it often applies to people who are taking at least one medication where we are pretty sure that the harms outweigh the benefits, but it certainly applies to people who are taking 5 or 10 medications. And again, the scientific term is poly, meaning many, polypharmacy, so many medications. It matters because there's something that we can do about it. We can potentially prevent the harm by identifying people who are experiencing medication overload. And if we can identify those people, there's something we can do. We can actually intervene, we can review the medications, and we can actually make a regimen that's safer and that reduces the risk of harmful effects. We want to do this because when somebody is taking one or more of these medications that is potentially not appropriate for them, again, it increases the risk of falls, fractures, memory problems, interactions between medications, hospitalizations. And there's actually been surveys of older adults in Canada that have shown that this is an extremely important issue to Canadians. aging at home, maintaining our autonomy. These are top priorities for many Canadians. And so if you can identify somebody with medication overload and you can intervene, you can actually help to preserve that dream of maintaining autonomy and of aging at home, which is something that we are all really looking forward to. So when we look at people who have medication overload, we see that the side effects are causing hospitalizations among older adults that are preventable. Many of these go undetected. So if someone comes into the emergency room and they've had a fall, we don't always look to see if the medications are the cause, because sometimes it's very complicated. Sometimes people aren't able to give a history at the time when they fall down, but about 10% of hospitalizations in older adults are related to the side effects of medications. And of course, some of those medications are, again, needed and beneficial. If you take a medication to prevent stroke, it can cause bleeding as a side effect, but we feel that that medication in many people is beneficial. And even though there are side effects, the benefits of that medication are most often discussed and felt to be more than the potential harms. So, it's always a trade-off. No medication has no side effects. So every medication that we prescribe, there's always some side effects to it. But if we're prescribing it, ideally, it's because there's been a conversation where the person and the family have been involved in the discussion and they agree, yes, I'm going to take some risk with this medication because I think the benefits on the whole are best for me. So if you take multiple medications, it also means that we are at higher risk of forgetting medications or making certain mistakes like taking twice the dose or missing a day of medication. So this is true for people of all ages. As soon as you prescribe more than 2 or 3 medications a day, it can be very challenging to remember to take them. If we look at people of all ages and just look at antibiotics, for example, maybe it's the only medication that a person is taking and they only need to take it for 1 week. Many people will miss doses of antibiotics. You can imagine that's a transient medication. What about when you're taking 10 medications and some of them are 2 or 3 times a day? It can be very difficult to pause your day, take your medication, remember to take it 3 times a day, and also, for example, time it with other medications, because sometimes you can't take certain medications together, or time it with your meals, because some of those meds, it says you have to eat with this, and others it says you can't eat with this. So then some people are spending really their entire day managing their medications, trying to follow the rules, and it can be really challenging. And naturally, mistakes would happen where we would forget or we might duplicate a dose. Then the other aspect of this is that more and more there are natural remedies and over-the-counter medications and vitamins that are being offered. And these too add to the kind of pill burden that someone is taking. So there's vitamins, supplements, herbs. Sometimes these natural products don't have a predictable level of the drug in them. So like a vitamin can be a drug, it can be a medication with side effects. Like things like iron and calcium have side effects to them. And when you buy certain natural health products, it isn't always predictable the amount of that medication in the pill, because the regulations are different. We have traditional medicines as well. So there are medicines that can be incorporating plants, animal, mineral-based medicines. And very interestingly, some of these medications actually can interact with other medications. You might not think so. You've bought it maybe over the counter, something like St. John's wort. That can interact with a medication and cause increased bleeding. But we don't always know that because there aren't necessarily warnings. And there are just so many natural products and medications that it's impossible for one person to know every rule. Then there's over-the-counter medications, again, that can interact with other medications like Tylenol and Advil and Gravol. And sometimes we even see pharmacies, you could go and buy a medication called Sleep Ease, and that actually is something like Gravol or Benadryl, but they've just given it a different name. And so sometimes we buy medications where we don't even actually know what's in them. We think it's something else than what it actually is. So all these medications can interact together and they can cause more interactions and side effects. So you can see why I think, Linda's eyes were opened when Justin Turner gave that talk, because there's just so many things to think about and factor in, and it doesn't always come up in a 10-minute conversation with your doctor or your pharmacist. Probably you know this, but you might not. Alcohol and cannabis and other recreational drugs can interact with certain medications. So cannabis isn't always benign. It can interact with a sleeping pill or with other medications. It can cause drowsiness. Some medications, when you take them with alcohol, can increase your risk of falling, can make it even less safe for someone to drive. And so, this is also something to watch out for. So there are medications that are more risky than other medications. And you have a medication that's risky when, again, it's that key, the risk outweighs the potential benefits. And usually we talk about a risky medication when there's a safer option for treatment for this condition. And sometimes that option is even better than the risky medication. Sometimes it's even more effective. And sometimes that option is not a pill. So for example, we know that cognitive behavioral therapy is more effective and safer than sleeping pills for sleep. So just something to think about. Talking about sleeping pills, these medications are considered risky and they affect our brain in different ways. So these are some of the things I want you to remember, and maybe speak to them with your family member or someone you love, or think about it for yourself. But sleeping pills, they reduce our reaction time. So remember I talked about that car crash from someone who still had Zopiclone in their system the next day. If you're driving, even if it's the next day after taking a sleeping pill, that medication can still stick around, especially in women, especially in older adults, especially if you're taking other medications like opioids or pain medications that can interact. So it can reduce your reaction time, meaning you don't hit the brake in time for the stop sign or the red light. It can affect your judgment and your planning. It could affect your memory. And what's really tricky about this is we see more sleeping pills prescribed to older adults than younger adults. And when older adults mention that they have memory problems, oftentimes these symptoms of things like coordination, concentration, memory, when they are altered or changed, we can be quick to attribute this to the process of aging. And some of that may be true, but some of it may be because we're actually taking a medication that's affecting those things. And sometimes prescribers are more quick to attribute some of these symptoms or changes to the process of aging, and less likely to take a look and see, well, could this be due to a medication? And is there something modifiable here? Could we improve this situation? So they also don't work so well. And I know that this is a very hard argument to make, because there are certainly people who have taken sleeping pills before, and you know that if you take one, you feel drowsy. So here's what the science tells us about sleeping pills. They do make people fall asleep faster. Okay, so that's why when you think of your sleeping pill, you're like, okay, but I definitely feel drowsy when I take it. It's not that much faster though, about 14 minutes. And then we have to think about the trade-off, right? So you fell asleep a little bit sooner, but for every 6 people that we give a sleeping pill, we see a serious adverse event, like a memory problem or an accident or a fall and a fracture. And when we look at the quality of the sleep is not very well improved by sleeping pills, but it is with cognitive behavioral therapy, for example. And so taking a sleeping pill, if you look at the studies for sleeping pills, they were only ever meant to be given for short periods of time. So really sleeping pills, if they're prescribed at all, are meant to be I guess Cookie Monster would say it's a sometimes treat, you don't have cookies all the time. So sometimes we prescribe them for 7 days if there's something, very dramatic happening in life. but they were never meant to be prescribed for 10 or 20 or 30 years. And we never looked at, well, what's the long-term impact of affecting somebody that way? And so, yeah, this is definitely a risky class of medications where we have to balance the potential benefits, which are, you can see them, they're on the screen. Faster sleep by 14 minutes, not much improvement in the quality with the potential risks. So I mentioned that you have cognitive behavioral therapy and that's a safer opportunity for improving your sleep, because sleep is incredibly important, right? It is something that allows us to function the next day. If we sleep better, our memory is better, our coordination is better, we're sharper, our mood is better. And so this is not to minimize what insomnia is like, or to say that lack of sleep is not important. Sleep is incredibly important. There are safer alternatives. So sleep therapy, or cognitive behavioral therapy, is really the first line treatment for insomnia. And, up until a couple of years ago, it was, pretty hard to access sleep therapy. But mysleepwell.ca is a really great organization that is Canadian-based, that has a ton of resources so that you can actually kind of guide yourself through sleep therapy with their online resources, so that you wouldn't necessarily have to get a sleep coach or access a psychologist, for example, because now these resources are much more readily available. These interventions, sleepwell.ca, with their tools, have actually helped people get off of their sleeping pills. And if you want, you can go and check out our website or the Sleepwell website, and you'll see testimonials where people talk about incredibly, just how much better they felt when they were able to get off a sleeping pill that they'd been taking for many years. So older Canadians who take at least one risky medication, we talked about how many take 5 and how many take 10. Well, actually, a lot of older adults take at least one medication that we could review, and that we could potentially decrease or change to something safer or even stop. So about 50% of women have one, and about 40% of men have one. The medications are pretty costly. So because they can lead to things like falls and fractures, taking a risky medication does contribute to us spending about $1 billion per year in Canada on medications that we know that we could change to safer alternatives, or even stop because the benefits aren't really there. There's also an impact on the environment that we're starting to consider more and more, right? So medications do contribute fairly significantly to the production of greenhouse gas emissions and contribute to climate change. There can be contamination of the water and the soil, and also it's a cause for loss of biodiversity. So if you're environmentally inclined, this is also something to consider when you're looking at your medications and, how to dispose of them and whether or not they're needed. So, complicated topic, but how can we work together to prevent the harm from medications? So I want to talk a little bit about the process of prescribing. The process of prescribing involves what is called deprescribing. And so a medication has a lifespan. When it is prescribed, we're starting to think about how long do we need to prescribe this medication for? And the most easy example to think about is an antibiotic. That has a lifespan, right? So when I prescribe an antibiotic, I'm already thinking, how long am I going to prescribe this medication for? But we aren't always as good at thinking about the lifespan of a medication when it comes to medications that are prescribed for chronic conditions. But there may come a time in your life when your medication could be reassessed. At that point, it could be continued. Maybe the dose will be reduced. Maybe your weight has changed or your kidney function has changed. And occasionally that medication can be stopped. And so really, when we think about starting a medication, one of the important questions that we ought to ask is, will I always need to take this medication? And sometimes when I talk about this topic with my medical students and my residents, they're very quick to say, oh, this medication is for life. So we can do a better job of teaching about this in medical school. the fact is most medications at some point in time could be reassessed, and not all medications need to be continued for life. One reason is because the evidence changes. And so there are more studies now about sleeping pills than there were 20 years ago. We used to prescribe aspirin to everybody as primary prevention when they got to be older adults. But we did a study in the last few years that showed that actually that wasn't preventing heart attacks as much as it was causing serious bleeding. And so that notion of taking a baby aspirin, where we used to say to people, this is for life, you're going to take a baby aspirin. Now we revisited that in certain populations of people because we have new evidence. And so really we need to think about when we start a medication, is there going to be a time when we can stop it? And how often should it be reassessed? So some medications should be reassessed after a month to see if they're working. Maybe the dose needs to be increased, or maybe the medication simply didn't work for somebody, in which case we could stop it. Some medications need to be reassessed every year because they were never really meant to be prescribed for 10 years. So things like proton pump inhibitors to treat acid reflux. It's recommended that once a year we see if that medication is still needed, and we do a trial where we try to come off of it and see if the symptoms have gone away or if it's safe to come off the medication. So you can see these medications are really meant to have a lifespan where they get reassessed and potentially stopped, which we call deprescribed. So deprescribing means reducing or stopping the medication. We usually do this when we think the medication is no longer beneficial, or where that balance, that scale has tipped towards harm. And it's really something that is done in partnership with a healthcare professional. You're not meant to have to do it on your own. And the goal is that you maintain or you improve your quality of life, that you feel better, maybe that you save some costs associated with a medication that you didn't need to be taking. And it can reduce, for example, the burden of pills that you have to take. So maybe it just makes your schedule in your life easier. Deprescribing is really the strategy that we're using nowadays to help prevent or treat this issue of medication overload. So how do you access deprescribing? You can ask for a review of your medications. So a medication review is really a moment in time when you can identify any issues with the medications. It's an opportunity to discuss whether any medications could be reduced or stopped, otherwise known as deprescribing. There are places where this can be done in each province. It can be with a healthcare professional, so like a doctor or a pharmacist or a nurse, where they specifically review the medications. But you could imagine that this process takes a little bit of time. And so it's not usually kind of done on the fly. You would want to make a special appointment for this. You need to come prepared. So you could ask your pharmacy to print out your medications so that you could bring the list and think about what you're still taking, and be honest. If there's something there that you're not taking anymore, you can say so, and you could say why. And you want to list out other things that you're taking too. So some people will bring all their medications in a brown bag. So the over-the-counters, the supplements, traditional medicines, we're interested in seeing it all. Then you want to think about, what are your goals for your health, for your life? Are there, again, any medications that you think could be affecting you? Are you noticing some differences in your balance or your memory? You might ask, I don't really like how I'm feeling. Could some of these medications be contributing? Maybe the answer will be no, but maybe it will be yes. And if it is, then you could feel better potentially by decreasing the dose with the doctor or the prescriber. You want to think about what your goals and values are. Is your goal to, some people's goal is to continue their sleeping pill. And many times I've had people say to me, I like the feeling, I want to take it. That is a priority for me, is to keep that medication. Other people have said it's a priority for me to keep driving. It's a priority for me to continue doing my crossword puzzles. I do Sudoku. I want to continue being able to email my grandchildren. I knit. I want to maintain my dexterity. I want to maintain my balance. So everybody's priorities are different. travel or staying at home. Some people have said to me, I never want to feel heartburn again, and I do not want to stop my acid medication because that is the worst feeling in the world. And so there's no judgment because it's really different for everybody. And if you can think ahead of time about what's really important to you, and that could be treating symptoms, that helps to guide the conversation, and that helps the prescriber to come up with a plan for what to do with the medications. And yeah, I guess you want to think about, if my doctor comes back to me and says that you could potentially stop one or more of these medications, how do I feel about that? Would I be willing to do so if my doctor tells me it's safe? So here's a list that we made for you that you can use at your appointment. So again, we're going to circulate this afterwards, but when it comes to your medications, you might want to ask about certain ones. Why am I taking this one? And it is okay if you don't remember, because some people are taking a lot of medications, and it is perfectly fine to not remember which one is for what. What are the potential benefits? Like how does this medication help me? But also, can you tell me how this medication might be harming me? Like, what are the serious side effects? Again, can it affect my memory, or can it cause me to fall, right? Because a fall is a very big deal. Falling and fracturing the hip is very serious. It can be repaired, but going to the hospital can be a really challenging event for anybody. Staying in the emergency room, having to take pain medication, going to rehab. So you might want to ask, is this a medication that can cause falls? Can I stop or reduce the dose of this medication? And then how do I do it? Like, is this something that's done gradually? Can you give me a plan? And then who do I follow up with? Because maybe, for example, you could follow up with your community pharmacist. Maybe you could follow up by phone. There might be a nurse in the clinic who you could follow up with. And then you'd want to know, like, around when should I do that? So again, a medication review could really help if you've been having some memory issues. Maybe if you've been bruising a lot, or you had a near fall, or if you've not been going to your usual activities, maybe your motivation is low, and you haven't really wanted to tell anyone, but you've been having certain troubles with something, and so you could bring that up. Like, a medication review might help. It could certainly help if there's just a lot of pills that you're taking, and some of them maybe are uncomfortable to take. Some pills are really big or hard to swallow, for example. Some pills give people nausea. And sometimes there's actually a simpler medication regimen. So sometimes there's combination pills. Sometimes there's medications in the same class that you could take twice a day instead of 4 times a day. Maybe the regimen could simply be simplified, and then that would make your life easier and you'd feel better. So these are some of the things a med review can help with. So we did collect some data about where you can get a med review in Atlantic Canada, but I do just want to warn that sometimes the health services landscape can change pretty quickly, and each province has its unique criteria for who's eligible for a medication review. And clinics and pharmacies do have their preferred process. So this takes advanced planning. You'd have to look into, is there a minimum number of medications that I have to be taking? Is it only for certain conditions, like for people with diabetes, for example? But, the information is available, and you could always call and ask. And then at that time, you could say, could I make an appointment for this? So certainly healthcare professionals can offer med reviews in Atlantic provinces. So a family physician, a nurse practitioner, an internist, a geriatrician. Pharmacies can offer medication review services for some people who are eligible. So there's collaborative care clinics, community pharmacy, primary care clinics. There's pilot projects going on in different provinces as well. This is a really great clinic that offers either virtual, which is really cool, or in-person medication reviews that are quite comprehensive. This is the Medication Therapy Services Clinic in Newfoundland and Labrador. And so if this is of interest, we can definitely send you a bit more information on it afterwards. And Jenny mentioned that I made a software that helps with this. So this is available to all Canadians. It's available for free. You can actually do your own med review. So you log in, You have to have your medication list, and you need the internet, and you need a device like a phone or a tablet, because it's going to send you a secure code by email, and that's how you log in. And we have videos that can show you how to do your med review. You would enter in your medication list, and it's very simple. You don't need to know the doses, just the name. And then it asks you some questions, like, have you ever fallen before? Have you ever had a heart attack? And then at the end, it gives you the report for deprescribing that you can take to your prescriber. So it's not going to show you all the medications, but it will say there's some medications here that we think you could discuss with your healthcare professional. Bring them this code and they can log on and see your full report. Now, some meds it will display to you right away. So it'll show you, for example, sleeping pills, proton pump inhibitors for acid reflux, because these are medications that have already been shown that the person themselves can be empowered to deprescribe them. And there's actually brochures available for some medication classes. So these are called Empower brochures. And it'll actually direct you to the Empower brochure. So you could start right away with your pharmacist on some medications. And then the others, basically, you get a report that you could go and discuss with your healthcare professional. And that'll take out maybe some of the work of the healthcare professional having to get the med list, having to review your medical conditions, having to kind of cross-reference it with the evidence. It really will start the conversation like pretty much with the whole roadmap of how to deprescribe. So it will just cut down on the time it takes to do this. So other things that you can do, you can seek out information about specific medications and why you're taking them, engage in discussion, spread the word about deprescribing. So, talk to your friends, talk to your family, talk to, if you're a caregiver, if you work in the community or for an advocacy group, you could speak to your community about this, talk to your government representatives. The whole idea is to ask questions, stay informed, be proactive about your health, and then really participate in making informed decisions about your medications. These are some other free resources for safety and deprescribing. So in blue there, that's our network. That's the Canadian Medication Appropriateness and Deprescribing Network. And we have brochures that have been translated. So if you have a family member or a friend who speaks Korean, we have all of our brochures have been translated into different languages. Even Icelandic, which might not be that common, but you never know. These are some articles that we have. We have articles on prescribing cascades. That's when you take a medication to treat the side effect of another medication. We have medications about what to do during heat waves, articles on what to do with your medications during the heat wave. Lots of really interesting reading material. I'm gonna pause there and I'm hoping we can take some questions.
Thank you so much, Emily. Before we get started with the questions, I just want to say it was so eye-opening to hear your insights as a physician into the real effects and challenges that your patients experience taking multiple medications, and as a researcher steeped in this information as well, and who clearly has an immense passion for ensuring that when patients take medications, these medications are really needed and of benefit to the patient and not causing them harm. So thank you so much for your time. We do have many questions in the chat, so I want to get started right away. And the first one is, has there been any research on body posture that is related to identifying when someone may be experiencing medication overload?
Yeah, that is a really interesting question. I guess the question is, if you're taking, multiple medications, can it affect, what comes to mind for me is gait. So does it affect how you walk and how it affects your balance? And that certainly is described. In terms of posture, I'm not sure, actually. I don't know if that's been looked at, but certainly it can affect your reaction time, how you walk, and your balance, and maybe even, how well you feel your feet when you're moving, which can affect your balance. And if you kind of topple or sway, how well you can bring yourself and right yourself. That can be affected by certain medications. And some of those medications are more likely when you take multiple medications. But so again, things like pain medications, bladder medications, medications for sleep, and then especially when they're taken in combination, these things can affect how you walk and your balance.
Ooh. And another question we got was, if you do forget to take your medication, is there a window for taking it?
Yeah, so there often is a window, but it is different for each medication. If you do miss a dose, you can definitely call the pharmacy and you can say, hey, I missed my apixaban. Should I take a double dose? Should I skip a dose? It's really different for every medication. And so you have to kind of ask because it's going to be case by case. But yes, medications do have a window where people will either say, take it right away if it's just 6 hours late, for example, or just skip it, just take it the next day. But it really is different for each medication.
Thank you. Now, if you are dealing with multiple specialists and struggling because they are maybe not communicating with each other, do you have any tips or advice there?
Yeah, so I think it's important to be able to very clearly voice when you have a concern. And I think if your specialists are not talking to each other, that's quite a legitimate concern that you could raise, ideally with the person that you trust most. So if it's your primary care provider, you might want to say, I'm concerned, about a lack of communication, and I'm worried that if I change this medication, that information is not going to be transmitted to my cardiologist. I think it's perfectly reasonable to kind of voice that concern. You can also ask for written documentation. It is tough that a lot of the onus ends up being on the patient, on the person to make these communication efforts. We continue to advocate for provinces to have a single electronic medical record, right? Where this would really be the golden answer to this problem, is that all doctors should be able to log in and see what the other doctor or prescriber has done, but this doesn't necessarily exist in all provinces. It is coming. So for example, in Quebec, they'll be moving to one electronic medical record starting next year. And in New Brunswick, for example, many of the healthcare providers use the same software. So that's really like where we're moving towards, because it shouldn't be on the patient or the family member to be the person carrying that communication back and forth between the prescribers. The honest truth is sometimes you will end up having to be this advocate for yourself, in which case you really want to make sure that, for example, if you go to your medical appointment, there's someone there with you to take notes. Or you may ask for, a short written summary that you could then bring to the other prescriber. So those are some, tips and tricks to get around the problem of us not having one EMR within one province.
Thanks. And we have 1 minute left. So maybe while I'm just putting my screen up, I'll ask you this last one. Is there growing recognition that many of the issues that are normally associated with aging are maybe not, or
Yes. Yeah. I think that prescribers are becoming much more sensitized to this than they were 10 years ago. Absolutely. So if you were to say, is it possible that my memory is declining because of a medication I'm taking, or could that be worsening the situation? I think that a lot more prescribers will be sensitized to that issue and will be open to hearing it nowadays.
Thank you.
Work to be done still, but we're definitely headed in the right direction.
Awesome. So we've reached the hour, 2 o'clock in Atlantic Canada and 2:30 in Newfoundland. I do just want to say, If you can take a few minutes to complete this survey, we really appreciate your feedback. It helps us improve our presentations, and we're really committed to ensuring that we provide the information that you need and to continually improving. So I think my colleague is going to put the link to this survey in the chat, and if you could please take a few minutes, we would really appreciate it. Let's see. We also, I think people's real stories are sometimes, they resonate with us more than stats and data. In our network, we work with patient partners, and we work with folks who are interested in sharing little bits of their stories. So if any of the topics discussed in this presentation resonated with your own, we are always looking for patient stories, whether it was you who took a medication that didn't help or perhaps caused harm, or if you tried reducing or stopping a medication. You can email the network or visit our website and just get in touch with us, and we'd love to hear from you and speak with you. You can follow us. You can visit our website. We have lots of great resources there. You can follow us on Blue Sky, on Facebook, and we have many videos on our YouTube channel, including this one, which will be uploaded after the presentation. I just want to acknowledge again that this presentation is made possible through a financial contribution from Health Canada. And the views expressed in this presentation do not necessarily represent the views of Health Canada. And we also want to gratefully acknowledge the following organizations for their support. Anything else from you, Emily?
No, I think there's a couple questions in the chat. I don't know, are we able to download that and maybe we could send a quick email response if it's, yeah, okay. So just to answer that last question, we'd be happy to do that. All right, thanks everybody. Have a great day.
Thanks, everyone.
Bye.
Thank you.